Canada in talks to donate extra COVID-19 vaccine shots to poorer countries. Canada has reserved enough doses to vaccinate residents several times over, is in talks with other governments about a plan to donate shots to lower-income countries, according to 3 sources familiar with the matter.
Here's a summary of the article.
4-minute read. Ottawa, Geneva, Canada, which has reserved enough doses to vaccinate residents against COVID-19 several times over, is in talks with other governments about a plan to donate shots to lower-income countries, according to 3 sources familiar with the matter. Canada could donate extra doses through the World Health Organization-backed COVAX facility, which would distribute them among recipient countries, said a Canadian government source. Separately, a COVAX source confirmed discussions were going on between Canada and other governments and organizations involved with COVAX, a facility created to ensure equitable access to COVID-19 vaccines. Canada's discussions follow a tack set by the European Union, which has told member states they can donate extra doses to low- and middle-income countries. Its aim is to make 2 billion COVID vaccine doses available by the end of 2021, and it has raised more than $2 billion in funding, but needs $5 billion more to meet its goal. If rich countries do not close that funding gap, and then wait until most of their own residents are vaccinated before sharing doses, millions of frontline workers and vulnerable people in poorer countries could face a long wait for vaccination. A recent vaccine modeling report from the Center for Global Development estimated that there would not be enough doses to vaccinate everyone until 2023. Canada, with a population of about 38 million, has ordered up to 414 million vaccine doses through 7 purchase agreements.
This post received a score of 22,000, with an upvote ratio of 96%. Here are the top comments in response to this article.
I understand how they reserved a bunch from 5 different players. But how does the pricing work in something like this? There's a difference buying 38M at $2 or $100 each.
They have an estimation on their break-even point and numbers of orders so they can give a price. If no one had committed to purchasing the vaccine from them, they could not give a price. Now for the ones that are making a profit off this, it's the same kind of thing. They know their profit margins, cost, and amount of orders. They know what they want to charge and what they want to make. By securing an order early and for a large order, you get better pricing, like all things.
For comparison, the flu vaccine costs about $12–18 per dose according to the CDC. The $3–4 per dose is practically nothing.
The 3 to 4 doses cost. The 12 to 18 is the drug company making money. I wonder what their cost is.
Well, it's the drug company, doctor, pharmacy, nurse, medical biller, medical coder, and not least the medical insurance provider making money.
People forget how long the chain goes, which necessitates high markups.
Greater than Canada, with a population of about 38 million, has ordered up to 414 million vaccine doses through 7 purchase agreements. In the unlikely event all 7 are approved, that would be enough to vaccinate the country more than 5 times over. It is expected most of the early vaccines will require 2 doses.
Redundant procurement is a necessary approach when the world is panic buying items of strong desire. I could see evidence that huge speculative buys were getting snapped up by private investment groups. Groups sitting on a big stack of cash were buying big blocks of inventory to flip them at inflated prices. We better make sure that the freezers we panic buy are legit.
There was an article recently about Danby, Guelph, Ontario, upping production on freezers specifically in preparation for the vaccines. I believe it said the freezers would be sold at cost to healthcare facilities.
Good Old Woods Refrigeration was an old Canadian brand of refrigerator manufacturing that I think eventually got bought by Danby. They used to make fridges for a heap of labels like Whirlpool, Danby and many others before they went tits up and got bought out. It warms the cockles of my heart to see them still going and important to Canada.
Irony that freezers warm cockles, a traditionally frozen item.
I'm a blue-collar Canadian who works in the longshore industry. I work insane hours. I contribute at the highest tax bracket. I am perfectly fine with this. We are a country of haves, and we absolutely need to help those who have not.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.